We continue to move toward a time when COVID won't disrupt our daily lives, a time when COVID is no longer a crisis, but rather something we protect against and treat.
That's Jeff Zients, the White House coronavirus response coordinator, amid promising signs that the numbers were trending downwards. The 692,000 new cases daily represents a week-on-week decline of about 6%. Similarly, hospitalisations, though still high, are down 8% over the previous week, while daily deaths, which tend to lag other indicators, currently average 2,200 per day, which represents an increase of 21%.
When we look at other disease severity indicators measured among people who are hospitalized with COVID-19, such as hospital length of stay, ICU admissions, and deaths, these indicators are lower with Omicron than during previous periods of high transmission. And this is likely attributable to two key factors. First, many people in our country have some level of immunity from vaccination and boosters or from previous infection. And second, it's likely that Omicron is less severe than prior variants. Although it's encouraging that Omicron appears to be causing less severe disease, it's important to remember that we are still facing a high overall burden of disease. Hospitalizations have rapidly increased in a short amount of time, putting a strain on many local health systems.
She was quick to point out that milder does not mean mild, given the substantial number of deaths, with over 870,000 succumbing to the virus in the US alone. On January 21st, over 3,400 people died in one day.
When you have over 2,000 deaths, 150,000 hospitalizations, and you have people who are now getting infected to the tune of somewhere around 700,000 a day, we're not there yet. Where we want to be is that sufficient control, and control we mean not eradication like we did with smallpox, that's unreasonable, not necessarily elimination like we've done with polio and with measles by mass vaccination campaigns, but a level of control that does not disrupt us in society, does not dominate our lives, does not prevent us to do the things that we generally do under normal existence.
A new kind of normal as it becomes increasingly possible that coronavirus will not be completely eradicated in the near to medium term, if at all.
If the degree of immunity in the general community population, either through infection plus boosting, either vaccine plus boosting, or just vaccine alone, those are the things that will hopefully get us to the point when we have antivirals to be able to treat people who are at high risk, that we no longer are in a situation of threat to our equanimity, threat to our economy, the threat to allow us to live a normal life. We believe we can get there because we have the tools with vaccines, with boosts, with masks, with tests, and with antivirals. That's what we talk about when we get to the point where we can, quote, live with the virus. But as Dr. Walensky emphasized, that is not where we are at this point. So we still have a way to go.
Dr. Fauci also clarifying concerns about the J&J vaccine. While the single-dose J&J has been shown to be less effective than, say, the two-shot mRNA vaccines against the variants, Dr. Fauci pointed to the mix-and-match approach, where one vaccine platform is later boosted with a different vaccine. He says they found that J&J works very well with an mRNA booster like Pfizer or Moderna, with protection quite parallel to those who just received a two-shot mRNA regimen, plus an additional third mRNA booster. Sherwin Bryceby's SABC News, New York.